Hello everyone and welcome to another session of NEXTSAVIOURS Essential Question Series for NEET PG 2025. Today we are going to have a discussion on a very important topic, that is Trendelenburg Test. The examiners in the NEET PG examinations are particularly obsessed with this questions on Trendelenburg Test, and they have entered into a second stage of asking the questions related to the Trendelenburg mechanism. So let's finalize it for once and all, that what is Trendelenburg test, what are the basics behind it, and how would the understanding of Trendelenburg test make it easier for you to answer the questions accordingly. So let's discuss the question that has been asked multiple of the times, like 32-year-old patient find it difficult to ride up the stairs. Now till this point it is absolutely easy. Now when he was made to stand on the right lower limb, the pelvic area of the other side dropped down, but when he was made to stand on the left lower limb, the pelvic area on the opposite side, it was lifted up. So where exactly the lesion is? And these sort of questions are confusing, and it is considered to be the first generation question for Trendelenburg test. Now let us understand what exactly is required for you to understand this topic. So the concept of center of mass, in order to have a bipedal stance, that means when both the feet on the ground, and to have a stable posture, that means a stable stance, the center of mass has to be there in the center of the body. But imagine if the patient is asked to bear weight on one lower limb, then in order to have a stable stance, obviously the center of mass has to be drifted towards the weight bearing side. That means the entire body has to get inclined towards the weight bearing side. Now, how is this achieved? This is obviously achieved through some mechanism on the hip joint, because that is the only region which is in continuity to that of the opposite side. You see, the foot is not in continuity to the opposite side. The knee is not in continuity to the opposite side. You cannot lift the body onto the shoulder. You are not lifting it onto the shoulder. Obviously, it has to be there somewhere in the pelvis. So all of us have seen a seesaw mechanism. Now, what are the components of the seesaw? The force is applied, and when it is transferred through the lever arm, it is getting concentrated at the level of the joint, that is fulcrum, and the opposite end of the seesaw is lifted up. So this is the basic lever mechanisms. Now, the levers can be categorized based upon the length of the arm into multiple of the types. And if we look at class 3 lever, what is class 3 lever? Where, this is the fulcrum, this is the resistance arm, that means the load has to be lifted from here, and this is the force that has to be applied, and the force arm. Now if you compare it with the seesaw, which was exemplified over here, then the lever arm on both the sides are of the same length. That means equal force is required, or lesser force is required in this case. But here, so if you look at the fishing rod, here the resistant arm is longer in comparison to the load arm or the force arm, thereby more force is required to lift the other end of the fishing rod up. And fishing rod is a classical example of class 3 lever. Now another classical example of class 3 lever is the abductor mechanism of the hip joint. The gluteus medius and gluteus minimus, which are attached to the tip of the greater trochanter, are the force. The greater trochanter, the lesser trochanter, and the head of the femur is actually the lever arm, and the joint, that means the synovium, acetabulum, and the joint surface of the head of the femur is the fulcrum. So here we can compare the class 3 lever action of the fishing rod with that of the hip joint, where there is a fulcrum, which is the joint, where there is a lever arm, which is the greater trochanter, the neck of the femur, and the head of the femur, and the force is applied by gluteus medius and minimus. So whenever the patient is made to stand on a single limb, like in this case, when a patient is made to stand on a single limb, then the force is applied by these gluteus medius and minimus. They contract, and when they contract, the force is generated, and this generated force will be transmitted all the way up to the level of the fulcrum, thereby lifting the other side of the pelvis towards the weight bearing side, thereby inclining the other end of the body, the hanging side of the body, towards the weight bearing side. So this is the abductor mechanism of the hip, which is considered to be the class 3 lever mechanism for the hip joint. and it is essential for maintaining the stability of the human body when he is standing on one foot or when he is bearing weight on one lower limb. Now, we have already understood that there is a force. The three component of the lever mechanism are the force, the lever arm, and the fulcrum. Now, what if there is a defect in the force? That means the gluteus medius and minimus are defective, which could be because of the direct injury to the muscles. It could be because of the injury to the nerve. That means they are inactive, they are non-functional. Point number two, what if there is a defect in the lever arm? That means there is a defect in the greater trochanter, in the neck of the femur or the head of the femur because of any pathology, because of malunited fractures, because of the neglected fractures. And what if there is a defect in the fulcrum? That means the joint is affected. In that case, the abductor mechanism fails to lift the other end of the pelvis. And then what will happen? When the patient is made to bear weight on the affected limb, but the abductor mechanism, there is a defect. It could be defect in any of the three components. Then this force is either not generated or is not effectively transmitted to lift the other end of the pelvis up. As a result of it, the other side of the pelvis, it drops down. And this is what the Trendelenburg test positivity is. So hope you have understood everything related to what is the importance and how to conclude that whether the Trendelenburg test is positive or is it negative. That means it is normal or is it positive. That means the abductor mechanism of the hip joint is affected or is not. Now, based on this, now we can much easily identify the question and answer it accordingly. Let's start with the sample questions. The question that has been asked, as I told you multiple of the times, we are repeating that question which was introduced in the first step in the introduction itself. When he was made to stand on the right lower limb, the pelvis area on the other side, that means left side, it dropped down. It's not like that the pelvis are two, that one is the left-sided pelvis and the other one is the right-sided pelvis. No, it is the end of the pelvis. When the patient is made to bear weight on the right lower limb, the left end of the pelvis normally should be elevated up, but here it is dropped down. It means that the pathology is lying in the right-sided abductor mechanism of the hip joint. That is point number one. That is side determination, particularly in these sort of the questions. But when he was made to stand on the left lower limb, the pelvic area on the opposite side was lifted up. Now here there is a comparison. When he was made to bear weight on the left lower limb, so the abductor mechanism of the left side is absolutely normal. That is why it was capable of inclining the other end of the body towards itself. That means left side is absolutely normal. And now they are asking about the lesion. Now, based on the four options, first of all is the side determination. You have already identified what is the name of the side which is affected. It is the right side. Point number two is what is the nerve which is likely to be injured. And you know, the two muscles which are responsible for abductor mechanism of the hip joint are the gluteus medius and minimus. And both of them are supplied by superior gluteal nerve palsy. So answer for that question is right-sided superior gluteal nerve palsy. So first point in Trendelenburg type of the question is always the side determination, that which side is affected. Now question number two. Trendelenburg test could be positive in all except. If we look at option wise, because you have all understood the basic reasons for which the Trendelenburg test could turn into a positive test. The first one is malunited intertrochanteric fracture of the femur. Why not? Because in case of malunion intertrochanteric fractures, there is a possibility that there could be a shortening of this distance and the lever arm would be inefficient to raise the other end of the pelvis. Thereby, there is always a possibility in those cases. So yes, it is possible. Point number two, option number two, post-operative patient following total hip replacement. You know, while performing total hip replacement, particularly through the lateral approach, there is always a possibility of a direct injury or to the gluteus medius and minimus muscles and to the nerve supply. So there is always a possibility that post-operatively there is, through the lateral approach in particular, there is a possibility for Trendelenburg test positivity on the operated side. Then is the fracture neck of femur. Now, as you already know, that in case of neck of femur, there is a fracture. It means that the lever arm is defective. So although the force is generated, but it is not able to, but this force is not able to get transmitted towards the other side in order to lift the pelvis up. And finally, so it also seems to be correct. And finally, old neglected posterior dislocation of the hip. Now, there is a catch point over here. Old neglected, that means the patient had a posterior dislocation of the hip joint. Okay. Day one, the condition was extremely painful. Over a period of time, the pain subsided. And because he is not getting any sort of a management, because it was neglected, now once the pain subsides and the fibrotic tissue role comes into action, the patient will start bearing weight automatically, maybe after 4 months, 5 months, or 6 months, although he will walk with the abnormal sort of a gait. So, because the patient is able to bear weight on the affected limb, and here also the lever arm component of the abductor mechanism is affected, so this option also seems to be correct. Now, if you look at all the four options, they all seems to be correct. But if you look at closely, that in case of fracture neck of femur, forget about the positivity or negativity. Can you ask a patient to bear weight on the affected limb? Then the answer for that question is absolutely not. In order to perform Trendelenburg test, the patient has to bear weight on the affected limb. That is the first prerequisite. If the patient is not able to bear weight on the affected limb, then there is no point in concluding the Trendelenburg test because the patient is having a fractured neck of femur. How you are going to compare it with the neglected posterior dislocations old? Because here, despite having all the abnormalities, the patient is bearing weight. But in case of acute fracture neck of femur, he is not able to bear weight. So these are the second generation questions related to Trendelenburg test, where obviously you have to use your conscious in order to mark the answers based on the background of understanding what the Trendelenburg test is. Coming on to the contraindications. So this makes us learn that what exactly are the contraindications where the Trendelenburg test should never be performed. Point number one, acute fractures and dislocations. Obviously, because the patient won't be able to bear weight on the affected limb, so you cannot ask him to do the Trendelenburg test. Point number two is a pain in hip joint. Now, if there is a painful hip where the patient cannot bear weight for the period of less than 30 seconds, imagine if the patient with the tuberculosis of the hip joint comes to you and you have asked the patient to bear weight on the affected limb. If the patient is not able to bear weight on the affected limb for less than 30 seconds, then you will just conclude by saying that the patient hip is acutely painful and he was not able to bear weight on the affected limb. So Trendelenburg test could not be performed. As simple as that. It is a contraindication. Point number three, abductor or adduction deformity of the hip. Now here there is a catch, that what exactly is abduction or adduction deformity of the hip joint and how they are responsible for getting us no inference out of this Trendelenburg test. You see, imagine if the patient is having an abduction deformity of the hip. Now imagine, because of any pathology, the patient is having abduction deformity. That means the hip joint on the affected side, that means right side in this case, is fixed in abduction. Now, what happens normally then when you ask to bear weight on the affected limb, the other end of the pelvis moves up. So, what is the inference of the Trendelenburg test? Whether the pelvis is moving up or not. Here, in case of abductor deformity or abduction deformity, the pelvis is already dropped down on the affected side in order to maintain the bipedal stance. So, abduction deformity is not a single deformity. Abduction deformity comes with the dropping down of the pelvis on the affected side also in order to compensate for the apparent shortening of the limb in order to have the bipedal stance. So pelvis is already dropped down, and when you ask a patient to bear weight on the affected limb, then this pelvis obviously is apparently elevated. So it gives you an incorrect interpretation on the Trendelenburg test positivity. Another point is adduction deformity. As I again told you, that in case the hip joint is adducted, then obviously the pelvis will already be tilted and you cannot draw the correct inference on already tilted pelvis, and that is why these are considered to be the contraindication. The first contraindication, as I told you, it is acute fractures and dislocation. The second one is painful hip, and the third one is the abduction or the adduction deformity. The fourth one obviously is the obesity, where you cannot draw out the inference based on the extreme fat which is arranged around the belly and the hip region. So hope you have understood everything related to these Trendelenburg tests. So finally, in conclusion, what are the 6 points which you have to remember related to this Trendelenburg test? The first obviously is the abductor mechanism of the weight bearing limb is on test. Remember which limb is on test, where the patient is asked to bear weight. If the patient is bearing weight on the right lower limb, the abductor mechanism of the right lower limb is on test. Side determination, very important. Point number two, if the other end of the pelvis moves up, the Trendelenburg test is negative. That means the patient is not having any pathology related to the hip joint when you are testing the Trendelenburg. Point number three, when the other end of the pelvis drops down, then it is Trendelenburg test positive. Acute fractures and dislocations, the patient cannot perform the Trendelenburg test, so it is obviously a contraindication. Now, if the patient is bearing weight on the pathological limb, like neglected or maltreated fractures, the dislocations, even the congenital dislocations of the hip, that is developmental dysplasia of hip. So, whenever the patient is able to bear weight on the affected limb, whether it is abnormal or normal, then he is a candidate for performing the Trendelenburg test. So he's a candidate for Trendelenburg test. And based on that, you will be drawing out your inference. And finally, what are the contraindications that we have already talked about? So these are the 6 lines, 6 points, which are essential for you to remember. This attempt is the best attempt. Many of the students, they feel that, next year we will give the examination. Next year we will prepare well, but that next year never comes. This year, this session in particular is the best, and you have to give your best whenever you are sitting in your examination. And for that, exactly, more than 2000 questions are available on NEXTSAVIOURS app for you to practice it out. There is a free sample paper also, so that you don't sit blank in front of your computer screens when you sit in the examination hall. It will give you a confidence, a sense of self-sufficiency, on the basis of which you will gain your confidence for the subsequent examinations. And particularly for the MBBS final year students and interns, it is the best mode of preparing yourself for the upcoming examinations, because ultimately you have to prepare, you have to sit in the examination, you have to get succeeded in every competitive examination that you are about to face. All the best, and thank you for listening the lecture. Any update, please join our Telegram group. All the best, and thank you very much.